Hello everyone. Today's video is about changes in the menstrual cycle from various natural treatments. As per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So there have been a couple of questions lately about different natural compounds leading to changes in menstrual cycle parameters, and I thought I'd just do a little consolidation video here on this topic. So the most recent question was, was on a video about high-dose sulfur therapy, also known as using high-dose MSM, methylsulfonylmethane therapy. And the gist of the question was this person, I believe, said they were 50 years old, they hadn't menstruated in quite a while, and they started MSM and they started menstruating again. And so they were wondering if this was something to be concerned about, or if this is abnormal, or what's the story there. But then they also mentioned that they looked it up online, and that some folks had younger individuals had posted that they started MSM and it actually stopped their menstrual cycle. So I haven't seen MSM directly impact menstrual cycles one way or the other so far in practice. I've had quite a few patients now on high-dose MSM. I've talked about this extensively in other videos, and I interviewed the leading expert in high-dose sulfur therapy, Dr. Kathleen Janelle, on my Overcoming Chronic Illness podcast. So please feel free to cross-reference that episode if you're interested in doing a deep dive into high-dose sulfur therapy. It's a really, really cool therapy, and I've just been really heartened to see there have been so many comments on that podcast episode video on my YouTube channel, and also on some of the other videos that I posted about MSM. Just folks, many different folks saying that they've really, really benefited from high-dose sulfur therapy, whether it's for their digestive issues, chronic joint pain. Those are the most common bits of feedback that folks give, but also just helping with their hair, skin, nail integrity. Those are the things that I see high-dose sulfur therapy helping with the most in practice too. So anyways, exciting topic, but I'm getting off topic here now. So I haven't seen any menstrual changes with MSM, but I have seen menstrual changes with other agents. Now, just to quickly touch on the internet reports of people losing their menstrual cycle going on MSM, that one I don't know. I don't know what to say to that one. I have not seen natural agents lead to amenorrhea, or loss of menstrual cycle, or oligomenorrhea, where there's sort of more instead of having a cycle every 28 days, now it's every 35 days, or it's really hit and miss or something like that. But I have not seen any impacts like that. Now, I have had many patients over the course of time where they're having really, really frequent menstrual cycles. So they're or say having mid-cycle bleeding, metrorrhagia as it's called, or they're just having a really, really heavy flow, and it's just really tanking their blood counts, and it's just really, really awful. And I've seen certain herbs like yarrow and shepherd's purse being two of the main ones work really, really well. So I've seen those herbs work miracles even when folks are having no response or only a partial response to pharmaceuticals that are supposed to help with that indication too. So herbs can work really, really well for helping to slow down unwanted excessive menstrual flow, but I haven't seen different supplements take away menstruation. Now, we always have to take what we read on the internet with a grain of salt, of course. I think the internet is wonderful, and there's so much useful information on there, and I'm a big proponent, actually. My patients come in sometimes a little bit sheepishly saying oh, I looked this up on the internet, and I know you're not supposed to do that. And I sometimes we're short on time, so I don't say this, but when we're good for time, I will very, very regularly say, I'm really glad you're looking up stuff. So many of my patients have come in because they're oh, I read about ozone therapy, I read about low-dose immunotherapy, I read about, my chronic symptoms could be due to Lyme, even chronic Lyme disease, even though, all the doctors I saw told me no, it's just, there's nothing we can do for you, and it's all in your head. There's a million and one reasons why it's great to look up things on the internet. So I'm a huge proponent of it, but at the same time, we do have to be judicious with the information that we glean from the internet, and check our sources and all of that good stuff. So with that being said, I don't know what the circumstances were around those case reports, but I would be very surprised if high-dose MSM actually shut down a menstrual cycle. That being said, it may have happened, and I'm not here to say whether or not that has happened, but I'm just saying it seems very unlikely, and maybe there were other concomitant factors that were afoot. Now, in terms of a menstrual cycle being reinstated due to MSM, I have seen that happen in several cases over time. Not dozens, certainly not hundreds, but I've probably seen that happen maybe 10 times in my practice career. So not many, but I have seen it maybe a little over 10 times. And so, like for example, I've had some patients where, say, they're in their mid to late 40s, they're no longer menstruating, they start on a B complex, and that brought their menstrual cycle back. And sometimes they're not happy about it because they were done with their menstrual cycle. And sometimes they're like, oh, okay, I guess like I felt like it was a little odd that I was done. And we know that there are certain health detriments to going into menopause too early. Women don't get to enjoy the benefits of all that extra estrogen for as long. And so it can have a negative impact on bone density and different things like that. Now, there are certain advantages where maybe there's lower chances of certain types of gynecological cancers. So like it's a bit of a mixed bag. But long and short of it is that I have seen, say, just a B vitamin do that, like a B complex do that. I've also seen that happen with certain herbs that are. I've also seen that with certain herbs that are geared at helping with hormone balancing. So I've had a couple of female patients over the course of time. They were having hot flashes, maybe some other perimenopausal symptoms. They start on the herbs, and their symptoms get better, and their period came back. Again, this is going to be women who are, say, like in their late 40s, maybe even like around I think I had one who was like 50 or 51. Her period came back, and she menstruated for a couple more years, and then it went away. So I don't look at it as being a bad thing. I personally look at it as like maybe there were these underlying health issues. There were obviously some hormonal imbalances, hence having some of these symptoms. They were coming in for treatment, or maybe the patients who were benefiting from the B vitamins, they were having some fatigue issues. Maybe the cells were just like, you know what, we don't have enough energy to run this menstrual cycle anymore, so let's just call her quits a little early, or sometimes a lot early, and then now we can make the energy again. So like let's take another crack at that menstrual cycle. So I personally view it as probably being a net good thing. Now, I'm also easily able to say that because I don't menstruate, so I understand it can be inconvenient and this and that, and sometimes very symptomatic, and certainly not downplaying that. But I think philosophically, menstruating until a woman is 50, 51 on average, maybe a little bit longer for some, maybe a little bit shorter for some. It's plus or minus a couple of years there, but that's I think the healthiest thing for overall physiology, to my understanding. I have also seen menstrual cycles come back in younger individuals who are not menstruating because they're really, tired, depleted, dealing with, chronic health issues. And I've seen that come back from appropriate treatment for Lyme and mold illness. And then also recently a patient who started using high dose B12, which has been helpful for their energy levels. And that has also coincided with their it helped their energy levels, and also brought back their period that had been gone for, I think, like 3 years or something like that. This individual is, I think, in their, I want to say, early 20s or something like that. So it was, anyway, so very, very welcome that came back, because obviously that's a normal physiological process to be happening. So yes, sometimes natural agents will bring back a menstrual cycle that seemed to be gone. Sometimes that's very much age appropriate. Sometimes it's a little bit of a surprise. Yeah, anyways, I've said my piece on that. So I'll leave it there for now, so I don't just reiterate what I've already said. If you wouldn't mind, please taking a quick moment to like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And if you have any questions on this topic or on anything else, just post in the comment section below, and I will do my best to answer as soon as I can.